So I did everything I could to plan for pregnancy. I changed medications, I asked questions of my healthcare professionals, I planned ahead. But when the moment finally came, I realized that I didn't have enough information. So there wasn't clear research to say take your medications or not. I was diagnosed with juvenile rheumatoid arthritis when I was 14, and later on in my 20s with hypertension. And so medications have always been a big part of my life. As a teenager, I remember some advice provided by my pediatric rheumatologist who warned this medication that you're taking won't be safe if you ever get pregnant. And so that stayed with me. It's funny, it's just like a singular moment, but it stayed with me. So when you fast forward another 10 or 15 years, I remembered that. So when my partner and I were, getting ready to start a family, I brought it up early, right? I talked to my family doctor who actually referred me for counseling on all of my medications with a team of specialists. And so it was at that time that I switched one of my medications to a safer option before we even started trying to get pregnant. And so I thought that I was ready. But when I got pregnant, I felt that there was no ideal option. So for both pregnancies and with the support of my healthcare team, I decided I would stop taking my medication once I got pregnant. And for my first pregnancy, that worked okay. But during my second pregnancy, the pain got worse almost immediately, and different symptoms started to appear as well. And my rheumatologist and my obstetricians couldn't quite figure out what was going on. And so we followed up with our backup plan, which was to take corticosteroids to manage my symptoms. We started low, but by the third trimester, I was actually taking quite a bit of a higher dose. And throughout all that, I felt like the weight of the world was on me as well as my partner, right? I constantly wondered, am I doing the right thing? Would it hurt my baby to keep taking some of these medications? Or would it hurt me to stop taking some of these medications? And so once he was born, I actually felt incredible relief that I didn't have to worry about any of this in terms of my core health. But then I started having to make choices around breastfeeding. And it wasn't easy for me making all of these choices, right? But I was surrounded by support, whether that be, my partner or all these healthcare professionals that were supporting me. And one moment in particular struck me. It was from my family doctor as I was trying to make a choice around whether to breastfeed my child or take these medications. And she said to me, there's so much more to being a parent than this. And this is just a small moment and a longer life commitment. It really helped me let go of some of the guilt and kind of gave me permission to focus on my own health so that I could be the best mom that I could be at that moment in time. And it really helped me let go of the guilt and to understand that managing my health was just as important to being the best mom that I could be. So in terms of my advice to others, just remember that you're not alone. Explore resources. I've developed a number of resources with the Canadian Arthritis Patient Alliance, but also visit healthypregnancyhub.ca for reliable information and support on trying to make the right choice for you around medications and pregnancy. So just remember that taking care of your health is just as important as taking care of your baby.